Erectile dysfunction means a persistent inability of a man to achieve an erection which is adequate in terms of hardness and duration for satisfactory sexual intercourse. So long as a man can achieve a hard enough erection to permit vaginal penetration with a long enough staying power to perform a sexual act till ejaculation is attained, he is judged to be potent. The number of rounds per section is irrelevant. The condition may be classified as organic, psychogenic, or mixed in terms of etiology. As primary, never able to attain or maintain an erection for satisfactory sexual intercourse, or secondary, where impotence occurs in men who have previously had a satisfactory sexual performance. The causes are psychogenic from anxiety, depression, stress, and marital conflict. Could be organic from vasculogenic causes like arterial insufficiency or occlusion, as venous incompetence too. It could be neurogenic, peripheral neuropathy, spinal cord lesions. Could be traumatic on penectomy or pelvic fracture with urethral rupture, also pineal trauma, also endocrine, diabetes mellitus, hypogonadism, hyperprolactinemia, and pituitary, adrenal, and thyroid disorders. Also drugs, for example, antihypertensives, antidepressants, post-operative cystectomy, radical prostatectomy, and abdominal perineal resection, also inflammation from urethritis, prostatitis, also mechanical from congenital pineal abnormalities, Peyronie's disease, and also endurance related like heart, renal, or liver failure and pulmonary insufficiency, also post-priapism. But the symptoms are inability to achieve erection, inability to sustain erection, reduced sexual desire. The signs that are usually elicited are features related to underlying causes, like hypogonadal features, for example, gynecomastia, lack of male sexual characteristics, pineal plaques or plaques, and curvature. That's Peyronie's disease. The investigations are FBC and circulating status, lipid profile, urinalysis, fasting blood glucose, serum prolactin, and serum LH, FSH, and testosterone. The main treatment objectives are to determine causative factors and treat appropriately to restore sexual potency. Erectile dysfunction may be the first warning sign of underlying cardiovascular disease like myocardial infarction. Non-pharmacological treatment. So patients should avoid excessive alcohol consumption, cigarette smoking, recreational drug abuse, and excessive weight gain. Also psychosexual counseling. Pharmacological treatment. Treatment should be directed at underlying cause, for example, change or discontinue medication if found to be the cause in consultation with the patient's physician. The drugs for erectile dysfunction, for example, sildenafil, tadalafil, and vardenafil as PDES inhibitors, can be prescribed as first-line treatment after careful cardiovascular evaluation. So they are contraindicated in ischemic heart disease and those on nitrates. So sildenafil citrate 50 or 100 milligrams 30 minutes to 1 hour before coitus, or tadalafil 20 milligrams 30 to 60 minutes before coitus could be given, or vardenafil 10 to 20 milligrams 30 to 60 minutes before coitus. So these medications require sexual stimulation for optimal results. Prostaglandin E must only be used under specialist care. Referral criteria: Referral to a specialist center is necessary for proper evaluation and management in most cases.